Hi, welcome to the Healthy Life channel. Are you sure your liver health is okay? Or is there something actually going on inside your body that you don't realize? Every day, your liver works non-stop, filtering toxins, processing nutrients, keeping your body healthy. But did you know more than 2 million people in the world every year experience liver damage without any obvious symptoms at first? Even more shocking, most of them only realize it when it's too late. What if your body is actually giving you signs, but you're ignoring them? Unusual tiredness, small changes in your body, these can all be early warnings. Many people don't realize such small symptoms could be the first warning that your liver is in danger. So recognize the early signs of liver problems before it's too late. 6. Skin itching. Itching that spreads across the body without any obvious rash or allergies is often a sign that your liver is having problems. This itching is caused by a buildup of bile salts in the blood due to a disruption in the flow of bile. Normally, bile salts are secreted into the intestines to aid in fat digestion, but if the bile ducts are blocked or the liver is damaged, bile salts will build up in the blood and cause intense itching. This itching is usually worse at night and is difficult to relieve despite the use of regular anti-itch medications. This condition is often accompanied by other symptoms, such as yellowing of the skin and eyes, dark urine, and pale stools. Causes may include primary biliary cirrhosis, bile duct cancer, or hepatitis. The main treatment is to address the underlying cause of the liver or bile duct disorder. 5. Decreased appetite and weight loss. When your appetite decreases drastically and you lose weight for no apparent reason, this could be a sign that your liver is in trouble. A damaged liver often leads to metabolic disorders and toxin buildup, which can affect appetite. People with this condition may feel full quickly despite eating small portions, and often feel nauseous or even vomit after eating. This weight loss is usually accompanied by a loss of muscle mass, making the body look thinner, although the abdomen may appear enlarged due to fluid buildup. This condition is often found in patients with cirrhosis or liver cancer. To determine the exact cause of these symptoms, your doctor will usually perform a series of tests, including blood tests and imaging, and provide a treatment plan tailored to your condition. 4. Dark-colored urine and pale stool. Dark urine discoloration and pale or whitish stools are typical signs of liver or bile duct problems. The dark color of urine is caused by increased bilirubin in the blood, which is then excreted through the kidneys. Meanwhile, pale stools indicate a lack of bile entering the intestines to aid in the digestion of fats. The condition is often accompanied by other symptoms, such as yellowing of the skin and eyes, nausea, and discomfort in the upper right abdomen. The main causes of these changes include hepatitis, cirrhosis, or bile duct obstruction due to gallstones or tumors. In some cases, these changes can be an early sign of a more serious condition, such as pancreatic or bile duct cancer. Doctors will usually perform blood tests to measure bilirubin levels and liver enzymes, as well as imaging such as MRI or CT scans to confirm the diagnosis. Prompt treatment can help correct this condition before it develops into something more serious. 3. Easily tired and weak. Feeling tired all the time, even after resting, could be a sign that your liver is not working properly. The liver serves as the body's metabolic engine, processing nutrients from food into energy that can be used by the body. When the liver is compromised due to diseases such as fatty liver, hepatitis, or cirrhosis, this function becomes suboptimal. As a result, the body lacks energy, and you feel tired easily, even with light activities. In addition, toxins that are normally cleared by the liver can accumulate in the body, which also leads to a feeling of weakness and powerlessness. People with this condition often lose their appetite, feel nauseous, and lose weight for no apparent reason. In advanced stages, this weakness can also affect daily activities and quality of life. Liver function tests such as ALT, AST, and albumin tests are important to evaluate the extent of liver damage. Early treatment is essential to prevent this condition from developing into a more serious one. 2. Swollen abdomen, ascites. A visibly enlarged abdomen is a symptom often associated with ascites, a condition where fluid accumulates in the abdominal cavity. This is usually caused by portal hypertension, which is high blood pressure in the blood vessels of the liver due to damage such as cirrhosis. In addition, a damaged liver is unable to produce enough albumin, a protein that keeps fluid inside the blood vessels. As a result, fluid escapes from the blood vessels and fills the abdominal cavity. People with ascites may experience abdominal heaviness or pain, difficulty breathing as the fluid presses on the diaphragm, and weight gain despite the apparent shrinkage of the body's muscles. This condition often indicates that the liver has been severely damaged. In addition, the fluid buildup can become infected, causing a dangerous condition called spontaneous bacterial peritonitis. Treatment involves the use of diuretic drugs to reduce fluid, and in severe cases, medical measures such as the insertion of a shunt or even a liver transplant. 1. Yellowing of skin and eyes. Jaundice. When your skin and the whites of your eyes start to turn yellow, this is a sign of bilirubin buildup. Bilirubin is a yellow pigment that results from the natural process of breaking down red blood cells. Normally, the liver will process bilirubin and excrete it through bile into the digestive tract. However, if the liver is compromised due to diseases such as hepatitis, cirrhosis, or bile duct obstruction, bilirubin cannot be processed properly and accumulates in the blood. As a result, the color of your skin, eyes, and even nails may turn yellow. In addition, you may also notice urine that is dark in color, like strong tea, which happens because the kidneys are trying to remove the excess bilirubin. On the other hand, your stool may become paler as bile, which normally gives stool its brown color, does not enter the digestive tract. This condition is often accompanied by a very annoying itchy skin, as bile salts also build up under the skin. Jaundice is a serious symptom that is often an early sign of various liver diseases, including liver cancer or chronic liver damage such as cirrhosis. Medical examinations, such as blood tests to measure bilirubin levels and imaging such as ultrasound or MRI, are essential to determine the cause and severity of this condition. The sooner these issues are addressed, the better the chances of preventing further liver damage. The liver is one of the most important organs that we often ignore until serious problems arise. Now that you know the early signs we've discussed, I hope you'll be more sensitive to what your body is trying to tell you. Don't wait until it's too late to act. Pay attention to the slightest symptoms, because health is the best investment that cannot be replaced. This video is for educational purposes only. If this video is useful, don't forget to like and subscribe so you don't miss other videos.